3, 2, 1, go.
We want to welcome all the members of the academic wing of assisted reproduction, Trichy, Tanjavur, and Tiruvaro, to this meeting where we have got a very, very eminent speaker, Dr. Sharda Jain. I would say more than a speaker, she's a leader because a leader is one who knows the way, goes the way, and shows the way. It's not just taking a post in an organization and not working for it. She works 100% for that, and she does not follow the path which everybody treads on. It needs lots of guts to go against so many set protocols and bring out changes, and madam is known for that. And that's why the topic she has chosen today is also very I would say revolutionary, because so many pharma are bombarding us with antioxidants for each and everything. So when we go for female infertility, we want to know like how much these antioxidants work. And it's my honor to introduce ma'am with a very, very short CV. I know it's very, very short, but it's an honor for us because we need all the participants to know about such a great person. And Dr. Sharda is fondly known as the teacher of teachers. She's a director of Life Care Center and Life Care IVF. She's a founder and secretary general of the Delhi Gynecologist Forum, a body of almost 2,500 eminent members. She's a founder and chairperson of the North India Gynecologist Forum, a body which is comprising of 10 states. She's an ethical committee member of the NMC and Bar MCI, an apex body of almost 14 lakhs modern practitioners. And she's there since 2018. She's been included as the top 20 most influential women in healthcare in India in 2022. She's a DMC expert since 2009 to till date. She's a passionate medical activist, has given leadership role in removing female feticide, movement of anemia, Save the Uterus campaign, Save the Ovary campaign, and Every Mother Counts, etc. She's given the concept of Janani Suraksha Yojana and Asha worker to the government of India, which we know is working so well in Tamil Nadu. And she's spearheading the movement of doctor safety, medical legal awareness, the unity of North India gynecologists, and is decorated with many lifetime achievements and Living Legend Award from many bodies, which includes LHMC, AA, FOXY, DMA, DGF, and WOW India. I present to you an eminent personality who will be giving a talk on female infertility, does antioxidants work? Madam, over to you.
My great regard to Dr. Jayam, and special thanks to Dr. Charmila and other colleagues of mine from South India. And I think this particular barrier of North and South India is broken. And I was requesting Dr. Charmila to take a lead when she becomes the vice president, that there should be uniformity as for the protocols and things are concerned, as far as IVF is concerned. I think, as a teacher, I found this is one particular specialty. There's so much of secrecy involved here. I don't know for what reason. Today, it's my pleasure that I'm going to talk on a subject which all of us are using it, doing it, and do not know why we are doing it. So I think I'll just take 1 minute to share my screen. Yes. I've chosen a topic on antioxidants in female infertility, whether it works or whether it does not work. And I think the knowledge is meant for sharing. And a small teacher wishes one thing, that at least there should be at least one take-home message after at the end of the talk. All of you know this great personality. He used to say that if you can't explain in simple words, this gives you an idea that you do not understand that particular topic at all, especially when it comes to teaching. And it's a fact that infertility experts in this particular country do not know anything about antioxidants, which they use left and right. I'm going to talk about oxidative stress, the antioxidants, the paradox of ROS and antioxidant use in female infertility, Cochrane results, and conclusion. We all know that antioxidants have flooded the market. They're readily available, but mostly unregulated area. Significant of a number of doctors use it, taking antioxidant and expectation that will improve the chances of conception of their client. And many doctors prescribe expensive antioxidants. Every day something new is coming up, which ordinary gynecologists do not know anything about it. Now, what is the evidence? Whether antioxidants improve fertility, there's a limited evidence. Trials show very different published antioxidants utility in female fertility. Whether this therapy works, whether it increases clinical pregnancy rate or live birth rate, any harm done by them, or as the time has come that it becomes a part of the IVF protocols. You can see that as far as oxidative stress is concerned, you pick up any area in female infertility, you can find it is giving a devastating reproductive outcome. We also see that there is increasing evidence to show that oxidative stress affects both natural and assisted fertility. This is a $1 million slide, which shows that every cell utilizes oxygen to produce its own energy. That's called ATP. And in this process, the free radicals are the byproduct. In a small quantity, they are very much needed by the cell. But when the overdose is there, it causes damage of cells, it causes damage of tissues, causes diseases and disorders. And that's why when the free radicals are accumulated in the body in large amount, it causes diseases, and antioxidants are disease preventive process. Now, reactive oxygen species, which all of us have to remember, plus the endogenous antioxidants, which are secreted in your own body, produced by your own body, are contained in a balanced level throughout the body. And this homeostasis prevents oxidative stress. सवाल उठता है कि antioxidants क्या हैं? These are biological and chemical compounds that reduce oxidative damage, give an electron to free radical molecule, convert them to configuration which becomes in speckles, just like water. They avoid damaging chain reaction, which can involve lipids, proteins, carbohydrate, various enzymes, DNA, cell, nuclear membrane, and up to the death of the cell. You can see here that reactive oxygen species are like robbers. They do harm to the normal cell, and antioxidants makes a free radical almost harmless. You can see the very right-hand side of the picture is what happens to a normal cell when it is attacked by free radicals. And the free radicals they have unpaired one electron. And because of this, they harm the normal cells. And what antioxidant does, it gives unpaired electron to this free radical and neutralizes this into ineffectiveness. So when you find a right combination of water, soil, and the sunlight is there, it nourishes the tree like this. The similar way, it is premised that antioxidants also bring back the fertility potential in an individual by giving the right kind of milieu. So infertility is the result of the free radicals mopping up in the system. The antioxidants cause lipid peroxidation, oxidative damage to protein, they damage enzyme, oxidative damage to DNA, cell, and the nuclear membrane, which I'm just trying to repeat again. Antioxidants are of two types. The natural ones, which are primary, enzymatic, and these are the ones which are secreted, produced in your own body. While secondary are the ones which are non-enzymatic, these are synthetic, and you take as a part of the dietary supplements. We all know about the vitamin C, vitamin E, and glutathione, beta-carotene, and all. And every day you find a new antioxidant is added to the kitty. This slide is a wonderful slide showing that there are primary antioxidants, which are naturally produced by the body, the secondary antioxidants, which we take as a dietary supplement. And these are the ones, antioxidants have a protective effect and create a balance in a body. The market is flooded with antioxidants, and new antioxidants have been added in the last 2 years: melatonin, estradiol, and even vitamin B and vitamin D. Now, antioxidants in a female are endogenously formed, and they're found in ovarian follicles, the follicular tubule, the peritoneal fluid, and endometrial epithelium. Gynecologists are always worried and looking for something new, a magic thing in their hands, because to give a child in a PCOS patient is a big problem. And age-related infertility is one thing which is, where she cannot do very much about it. Poor ovarian reserve, we find in all IRT clinics, the number is increasing from 30 to almost 50% now. And poor IVF outcome is embarrassing for the team, because you can't give the results, and there are patients where repeatedly it fails. Now, what are the various ways when we are using antioxidants? In a patient of infertility case, we alone use it, that it will improve their fertility. We use before an ART cycle, several months before, antioxidants, or we use it simultaneously with IVF as an IVF protocol. Single antioxidants and combined antioxidants have again flooded the market, and all of you must be using them singly or in combination. I repeat again, antioxidants neutralize reactive oxygen species by either preventing its propagating oxidative chain reaction or scavenging existing ROS. The merits of few antioxidants which we use daily without knowing the evidence for these antioxidants. Vitamin E, we all know about it, that it is improves epithelial growth in the blood vessels and as well as in the endometrium, and it is said to be protector of both the ova and the sperm from the oxidative damage. And we find that recent reports are coming up that our vitamin D levels definitely offer a benefit in the patients of PCOS by lowering hyperandrogenism, which is a key factor in PCOS. Vitamin C helps again to protect the cell and from the free radicals. Lycopene, we all know about it. It has definitely have a positive effect on the sperm quality in men. But as far as its role in a female fertility is concerned, is less clear, and more research is needed on this particular aspect. Now, coming to oxidative stress in relation to PCOS. We find that, the people of PCOD who want to conceive, they readily conceive, and the ones who do not conceive, they find it is a big challenge as far as the gynecologists are concerned to give them a baby. ROS from mononuclear cells, which then activate TNF-alpha, which further increases insulin resistance. And as we all know, insulin resistance is a key factor in PCOS, and TNF-alpha is a known mediator of insulin resistance. So you can see various antioxidants which have been working. That is vitamin E, which just now I said. It definitely improves the growth in the blood vessel, the endometrium. Vitamin D somehow decreases hyperandrogenism, which is found in polycystic ovarian disease. Myoinositol, again, there are tall claims, but not much in substance. L-arginine, again, improves endometrium blood flow. N-acetylcysteine, it is said to be needed for fertile cervical mucus and for ovulation. And this unsaturated fatty acids influence steroidogenesis, both in the sperm as well as in the ova. And everybody talks about this magic compound, which is called CoQ10. It increases the likelihood of pregnancy in male and female infertility, enhances the mitochondrial ATP production, and it guards DNA, lipid, protein from RS damage. It revitalizes the oocyte. It augments the grade 1 and grade 2 embryos, and it also prevents mitochondrial DNA defects and metabolic disorders. So this, again, slide is a repetition of what I've just now said. People are talking about CoQ10 these days. This reports have come that, when this particular product is used in PCOS, there is a twofold increase in the clinical pregnancy rate with this. Again, this has been quoted in Frontiers of Endocrinology in 2022 that it helps to neutralize physiological ovarian aging. And when it is used in poor ovarian reserve as well as in polycystic ovarian disease, again, there's a twofold increase in the clinical pregnancy rate is found with supplementation of CoQ10. We all know about the DHEA is a hormone precursor that can be converted into estrogen and testosterone, is often recommended for women with a low ovarian reserve before going for IVF. Again, I find in our practice also, it does good to some patients. L-arginine improves the endometrial blood flow. PUFA, I've just now mentioned about it, that it is needed for the composition of cell membrane of sperms as well as for ova. NAC has a promise. It is said that NAC usage in polycystic ovarian disease increases the ovulation rate by almost 5 to 6 times, pregnancy rate 3 to 4 times, and a live birth rate 3 times. The newer things which are added up are astaxanthin, which is 600 times more potent antioxidant than vitamin C. Vitamin B helps in homocysteine regulation and continuation of pregnancy. Vitamin D supports not only in PCOS by decreasing hyperandrogenism, but it supports pregnancy and fetal development. Melatonin is a new friend which has come in the market, helps to improve fertilization rate, implantation of embryo, and above all, it gives a good sleep when taken in the evening. So this melatonin improves IVF results and as delays ovarian aging, supports ART cycles, neutralizes ovarian aging, and it is needed for good embryo development. It is said that fertilization rate from the control group of 20% increases to 30%, increases to 50%, and a pregnancy rate from 10% increases to 20%, showing the benefit at both levels. The dose which is used is 3 milligram. It should be taken always in the evening. It should be started from day 5 till the day on the day of ovum pickup. There are a few RCTs are available which definitely favor the outcome in the terms of clinical pregnancy rate, but still adequacy of the data is poor, and it is not still recommended for a routine use. Now coming to the review of literature, whether the antioxidants improve fertility, whether age-related fertility cases, how much they can be of benefit. Polycystic ovarian disease, we all know that definitely does good. Optimized results in IVF efficacy, premature ovarian failure and insufficiency, and what is their role in recurrent IVF failure. In fact, this is my concluding slide before next 20 slides. That combined antioxidants which have flooded the market, there's no evidence between antioxidant causing increase in clinical pregnancy rate in endometriosis, unexplained infertility, tubal infertility, and people who are going for ART cycles, IVF annexing. There's insufficient evidence of association between antioxidants and a clinical pregnancy rate in women with polycystic ovarian disease. Now here I wish to just tell you, just like progesterone, if one senior doctor starts using it, all the students start using it, and then the private practitioners, general practitioners, everybody uses it. Antioxidants should be taken in the guidance of healthcare provider, preferably a reproductive endocrinologist and minimum fertility specialist. They can assess the individual circumstances, they can do tests, and they can monitor this particular patient. One thing we must be very clear, what works for one person may not work for other patients. There's definitely some evidence to show that CoQ10, DHEA, vitamin E, and the lycopene have a promise. They do benefit fertility, and they can be used or tailored depending upon the individual needs. And at the end, our aim should be personalized and evidence-based strategy we should adopt for each and every patient of ours. Now, there's a fashion to give combined supplements these days, and like on the left side are the ones which are favorites in this combination. And in the context, people they are very expensive antioxidants which are available. Some studies show that they have wonderful results. Other studies show they are mixed results, and there are few studies show that they do not have any outcome. Of all the individuals antioxidants which have been available, pentoxifylline has been given a lot of grades, and it is said that it is used in the dose of 400 milligrams twice a day for 12 months. It thickens the endometrium, it increases the number of oocytes, and the quality of oocytes is better. The endometrium thickness is great. Evidence is still insufficient. I had one colleague of mine who had been trained in South India. He did his fellowship from there, and he was very fond of using pentoxifylline. But I found him over the period of 10 years he had been with me. Slowly and slowly, his love for pentoxifylline had gone away. I have no experience of mine as far as using this particular antioxidant is concerned. As far as vitamin D is concerned, the evidence is again limited in PCOS. Then what is the Cochrane evidence is there that it has to be, a beneficial effect is definitely seen in PCOD, but still minimum, and more data is required for recommendation for one and all. Now, whether antioxidants in female infertility are associated with increasing the CPR, clinical pregnancy rate, again, the evidence is poor. Evidence is poor for antioxidants used left and right to increase the live birth rate. Now, women undergoing IVF, there is again no evidence to show that antioxidants increase CPR, clinical pregnancy rate, and live birth rate. Mind you, it's a fashion to use expensive combined antioxidants. Few studies show an association of increased pregnancy rate, but however, more data is required. Single antioxidants, no association is seen with clinical pregnancy rate except pentoxifylline. I like to have comments from the senior people present here. Now, pentoxifylline, as far as IVF ICSI is concerned, again, the dose remains the same. Again, they've used this particular drug plus vitamin E, and they found promising results. Again, more data is required. Now, as far as final thing is concerned, PCOS definitely antioxidant increase the clinical pregnancy rate. However, the heterogeneity of PCOS is extremely high. It has no beneficial effect in endometriosis, unexplained infertility, tubal infertility. In 2015, 28 trials having a large number of patients were enrolled, showed that antioxidant intake was neither associated with increased clinical pregnancy rate or low birth rate. Pentoxifylline was associated with increase in CPR in subfertile patients. Combined antioxidants are the ones which have multivitamins plus minerals plus amino acids which are chelated, did not improve oocyte quality and CPR in women with infertility undergoing IVF ICSI cycles. And we all know that Cochrane results are the best, and we all gynecologists look forward to these studies. Now, what is the Cochrane review? The meta-analysis came 2017, 50 trials involving a large number of patients, and they investigated oral antioxidants, combined ones, placebos, no treatment, standard treatment, and the results were published, and they showed that there's some definite improvement in live birth rate, clinical pregnancy rate, and decreasing the miscarriage. They found that, the live birth rate in fertile patients increased from 20% to 26 to 43%. As for the clinical pregnancy rate was concerned, using pentoxifile, it increased from 22% to 27 to 33%. As for the miscarriage rate was concerned, there was no difference at all. So in Cochrane analysis, definitely the adverse side effects were reported, like a miscarriage was there in spite of the pregnancy had taken place. There was OHSs and sometimes preterm births. Oxidative stress in ART, we know it that endogenous sources also produce oxidative stress. The gametes and the pre-implantation embryo have the potential to generate ROS, and exogenous sources are the lights which are used in IVF labs, the centrifugation, the cryopreservation, the culture medium, oxygen concentration, temperature, and the technique itself also definitely are associated with producing oxidative stress in ART. Now, lately, what they have done is they have started using these antioxidants in a cryopreservation media, and they found that they are finding that there's increased rates of blastocyst development, and they are supposed to be embryo protectant. Vitamin C again has been used in media, and again it is supposed to decrease DNA damage and increase rates of blastocyst development, and it improves the sperm progressive motility. As for the melatonin is concerned, it has been found to increase the number of fertilized ovum. L-carnitine, again, when used in culture medium, there is improvement in blastocyst development and preventing the lipid peroxidation. So what I find, it is antioxidant propaganda. The sales of the antioxidant from 2019 to 2016 skyrocketed, with the sales to women accounting to the largest growth. And most of the RCTs have been funded by the pharmaceutical companies. Meta-analysis of most of the studies show that there is, they sell few benefits and they underreport the bad effects. And most of the RCTs were inconclusive. So in conclusion, the combined antioxidants in female infertility, there's no evidence to date of association between antioxidant and CPR in women in endometriosis, in unexplained infertility, in tubal infertility, and patients who are going for IVF and ICSI cycles. There's insufficient evidence of association between antioxidants and CPR in women with polycystic ovarian syndrome. And as far as the male infertility is concerned, combined antioxidants avoid non-evidence-based drugs for a long time. Don't use anything for a long time. They are useful only in mild cases of male infertility, and they're not reliable for severe problem as for the male infertility is concerned. The question is, what is the option left to the gynecologists and infertility experts? Abhi to dena hi padega, whether there is an evidence or no evidence. So with this particular remark, thank you very much.
Thank you, ma'am. Thank you so much. It was, as usual, a very thought-provoking talk. I would say, as you said, the sales have skyrocketed. Every company who comes, they'll talk about an antioxidant with a new ingredient which is added, and nobody knows how the drug works. And as you said, there are no trials to tell us whether it really causes good or there's some harms also, because we don't know the harms which are happening. And we always attribute it to pregnancy, but we know that everything starts in the pre-pregnancy period. The pre-conception period is the most crucial time. And when you give antioxidants without a logic, we don't know how much it's going to cause harm. So from your talk, I would understand you can consider melatonin for a person who is PCOS. Ma'am, can you unmute, ma'am? Yeah.
I like to know from Dr. Jayam and other experts who are here, what is their take on this? बात तो ये कह सकते देना तो पड़ेगा ही, but उसका क्या logic है?
Jay ma'am.
Sharda and Charmila and all the delegates, nearly about 60 people have joined. Yes, time immemorial, this antioxidant is in existence. But there are no RCT studies, there are no guidelines in anything. Take it as ESHRE RPL or with the recent PCOS from the Australian group. They have not come out with a clarity that this is 1 + 1 is 2. They are saying 1 + 1 can be 2, can be 1, can be 3 also. Because there is a hue and cry being created for DHEAs. Because the study in America has been so much, and all these antioxidants have been studied only as a nutritional support. There is no pharmacological support for any of these drugs which we are talking about. CoQ, coenzyme, or any antioxidants. Anybody can prescribe it, and there cannot be any legal question on these drugs because they are not pharmaceutically licensed. Just like we can say, you can take Bonvita, you can take Horlicks, you can also take just milk. This is like that. But however, since the patients are eager to take something better than nothing, many of us have started prescribing, and probably we have allowed the nutritional product producing pharma companies to grow more with this tablet. That is what I feel.
There are no RCTs, there are no guidelines, but you are all senior practitioners who have been practicing ART for a very, very long time. So for some particular group of patients, you must have prescribed antioxidants, and what would be your choice as well as Sharda ma'am's choice? Madam has categorically said...
I will suggest that any patient of infertility walks in with you, spend one particular session on a diet and exercise with her. And that is the time, you can definitely tell about all these ingredients. People like me definitely say that you must buy vitamin C, vitamin E, CoQ10. And now these are available in Pradhan Mantri ki jo outlets hai. Those things are available. You should take in plenty yourself. You give it to your husband also, and improve your diet. I think that's much more wonderful job than, these going for an expensive antioxidant. And again, I will say that, I have no experience of mine with pentoxifylline. Whether anybody else has an experience, because that's the only drug which has got some evidence as far as the literature is concerned. The rest of the things we are using vitamin E, vitamin D, and all those things which we are using it. Now it has become a trend. Abhi pehle vitamin C, vitamin E, the vitamin D ka bhi shuru ho gaya. So this is what it is. I think, people like me see a patients who are coming from a higher class, though they don't mind getting a vitamin D level and a vitamin B level. So those people will definitely say that give me supplementation if it is required. So I think, I leave the talk with the mixed feelings. It is for you to take what you want to take after this particular talk of mine.
Yes, Jayam ma'am, what is your experience? Madam has said
pentoxifylline. Yeah, about 2 decades ago, pentoxifylline was very much used for improve the motility of the sperms. Even in culture media, they used to add a little pentoxifylline. Dr. Pandian has done a lot of study on this. Thereafter, having studied for about 5-6 years, he slowly dwindled. And at that time, when he was doing the studies, he was very much enthusiastic, saying pentoxifylline can be used. But thereafter, he came down, and he also did not go further, saying that pentoxifylline can be added.
Actually,
before 2000, they used to add it in the culture media itself.
Culture media, okay.
Yeah, to improve the sperm, especially when they do non-ICSI, direct IVF only cycles.
Actually, I'm reading about lifestyle modifications in PCOS at present because I'm doing a panel on that. So there is a study there where they say melatonin seems to help, And same way in FIGO, when we went, they were like talking only about melatonin in many of the forums. They were saying melatonin helps in the menopausal health. So will that correlate to, that's the way they're taking, if you sleep modify for a person who's got PCOS, this is going to help. Because they're saying for the sleep, when there's sleep disorder in a PCOS patient, she's going to have more of insulin resistance. She's going to have more of hyperandrogenism. So you're indirectly helping her by having a good sleep. She's going to have a better parameter. Should we take it like that?
The melatonin, I think, should be taken only to calm you down, have a good sleep. If nothing else, at least anxiety is taken away from you. And it's not expensive. So if it's not expensive, I think it can be used. The only thing everybody should remember, it has to be taken in the evening. So it coincides with the normal secretion of melatonin in your body. So that's the way I see things. But I think, the diet and your old advice, cheap advice is probably still the way. I will again ask anybody who can guide us as far as the combined expensive antioxidants, which should we take or not. I have given my say as far as the male infertility is concerned. That was not the topic today. But as far as the female infertility is concerned, we have no choice. We have to give something. Whether we select out the expensive ones or whether we select out the cheap ones is for us to decide.
Madam, as we progress in our practice, we are finding out in infertility patients, that is after they conceive and they have children, we are seeing that they have lots of health problems. It can be metabolic, it can be a cancer risk and all that. So there is a factor which is playing even when they're infertile. So and people are always asking for shortcuts. They don't want to diet properly. They don't want to exercise correctly. Just because I'm rich enough, give me a medicine which will actually bypass all this and I become pregnant. And we're seeing when we go into management of these patients and they conceive and deliver at the age of 40, 45, I'm seeing many women coming back with metabolic issues and cancer risk. So is there a factor that should have been corrected even when she's infertile? Because with your vast experience of yourself and Dr. Jayam ma'am, we'd like to know, like, suppose we give her a proper diet advice.
As far as the PCOS is concerned, as for the PCOS in South India, North India, the PCOSs are flooded. And if you want to save, once they have one failure, and I tell them that, I have your embryos frozen with me, they're worth about 2 lakhs of rupees. Please reduce your weight, come back. Otherwise, it will go waste. And once they have reduced, 10%, 8% of their weight, and they come back and they conceive. So I think, 50% problem of PCOS is normalize your weight. If you don't normalize your weight, doctors are not God.
But PCOS patients
and the metabolic issues are, madam, going to come if we don't exercise, if we don't moderate that thing. One thing is, everybody who's listening to me, a patient infertility walks into you in your clinic, please tell them home food, no food from outside. Don't pick up the food from outside and eat at home. That's also not permitted. So I think all these things, small advice we have to go. But I think, I'm not for expensive antioxidants.
Because lifestyle modifications can give you the same effect, which a drug like, because same thing, the ROS is going to increase when your lifestyle is not good enough with your diet or exercise, sleep patterns.
Since the time I've started doing DNA fragmentation tests, and you find that 50% or more than 50% have a DNA fragmentation which is pretty high. So the gentleman, is ready to cooperate with the wife, and as for the diet is concerned, as for the lifestyle modification is concerned, and I find that does much more wonder than anything else.
Yes. That's what the crux of the talk is today. Like, you rely more on lifestyle modification rather than costly drugs, which may not work out in the longer run. It's just going to add on to the budget of the patient. Any other opinion from anybody else before we finish the session? You can all unmute yourself.
I feel my request to the younger people is that, take up this particular area for the next 10 years and become, guide us from time to time.
Yes. Ma'am, Jayam madam wanted to say something.
No, yes. Please unmute everybody.
Everybody can unmute themselves. Chitra?
Yes.
Yeah, anybody can unmute and ask, because we kept the forum like that.
Please come forward.
Dr. Sureka has unmuted herself. Would you like to ask something, Dr. Sureka?
Yes, ma'am. It is a bit away from your infertility. There is a book I received, second edition of New Molecules, Equipment, Procedures and Obstetrics and Gynecology. And there is a very, very important article about myo-inositol working in PCOS. And I can tell you, I was rather thinking of writing to the author and tell me more about it, because it is very controversial that myo-inositol is really, really good. And it can only help, it is the only help for PCOS. There is a chapter for this in this book, which has been written.
My advice as a teacher is, I'm no researcher. When it comes in guidelines, please follow. Till the time it does not come in guidelines, be away from it. When people make guidelines, 20 experts sit, and every expert has a backing of 20 more experts. So when they speak in the guidelines meeting, they speak solid with experience. So please, ordinary people like us should follow the guidelines. When it comes in the guidelines, we will go ga. Until that time, we are going to keep quiet.
Madam, even if it is written by the authorities who are holding authorities in the subject.
Doctor, nobody's authority these days. You pay me the money and I become the authority.
Okay, I'll take it.
Madam,
Somebody has put a question. 9.6 AMH.
Can you
9.6 AMH.
Can antioxidants help in a patient of PCOS who's got a AMH of 9.6? Ma'am?
Sharda, ma'am.
See, let me be very frank with you. In PCOS patients, her lifestyle, her counseling, her meditation, her other things probably will help her. And even if she loses 5% of weight, whatever you're going to do is going to work wonders with her. But she should have a positive frame of mind here that everything is going to work for me. If she has a negative thing, it is not going to work. You remember surrogacy patients of ours. They have not been having a child for 15 years. Once the surrogate has a child, and then you find 2 months later, this lady is pregnant. Somebody is pregnant 3 months later. What is it? इतना बोझा रखा हुआ है तो कुछ तो होगा ही.
The psychological fact, we have seen that so many times. Patients adopt children and they become pregnant.
Yeah. Correct.
This is to Dr. Sharda Jain. Madam, since you are working for IVF also, for us, I'm not in IVF anyway. What is the cheaper and good antioxidant in the market? Can you name one or two for us?
I'm fond of melatonin. I'm fond of vitamin C. I'm fond of vitamin E and CoQ10.
Yeah, that combination is the cheapest and best at present.
प्रधानमंत्री योजना की दुकानों से जाएं और बल्क में खरीदें, अपने आप भी खाएं और अपने कुलीग फ्रेंड को भी दें जो कि इनफर्टिलिटी है. Ma'am, it's a positivity. I think, any clinic which teaches positivity to their patients will find success there.
And always it's better to talk to them as a couple. Then it makes more of impact on them instead of talking to one of the couple, because it actually increases the awareness, and the infertility part is much more easier to manage somehow when you can talk to both of them, and sometimes take the parents also inside. Anybody else would like to ask?
It is absolutely out of the way, but I will say that people who are not doing DNA fragmentation tests, they should start doing in their own practice. They'll find more men folk will be involved into it. And once they combinedly work for their fertility outcome, it will make magic.
And Dr. Kiran Sinha ma'am has asked, like, what about DHA?
I find DHA is good. People who marry late, 38, 37, and if you give them DHA, you find that, because they have not had, they have not wasted their eggs in miscarriages earlier and things like that. These are the ones which are which give you good news.
And there's a question from Dr. Sugant Kumar. Does the route of administration of antioxidant have an effect on PCOD and other treatments of IVF? You give only oral therapy.
It is oral.
It's only oral. Okay, I think we have finished the question.
And one thing is very clear. Endogenous antioxidants which my system produces, one can knock out 4 ROS,
Yes.
while supplementation will knock out 1:1. So you have to increase your immunity. The immunity comes right from here to the rest of the places.
Yes.
Your positivity, everything works. The endogenous antioxidants will knock out 4 people, while supplementation will only 1:1.
Yes.
That's correct.
Absolutely. Absolutely.
Absolutely.
Any other question to ma'am? It's already 6:40. We're going to wrap it up. Yeah. Ma'am, thank you. Thank you so much. It was like an eye-opener. And I think for the next 10 years, youngsters have to sit down, do research in Indian context and see how these drugs help or they don't help. Because if you're not going to do research, there's no point in us practicing in the future, because so much of lifestyle has caused so much of problems as far as the fertility arena is concerned. I have to thank a special thanks to
My
Dr.
request to Dr. Jayam and Dr. Charmila to you.
Yes,
Please
please.
out the common protocol which 95% of the IVF experts should use. Let's do it. If it can be
We
there
will
for
do it.
PT, it can be there for eclampsia, it can be there for severe PT, it can be there for gestational diabetes. Why not for this?
Yes, ma'am. We'll
Next
take up
year,
that suggestion.
we'll bring
do
out that. This year, Charmila is busy with her vice presidentship. Once she finishes this, AART, Academics of Assisted Reproduction, will give guidelines. We will start doing some GCPRs so that let them use it and give us a feedback. We will come
Yes.
out with it. Thank you for your good suggestion, Sharda.
Thank you, ma'am. Thank you so much. I'd like to thank all the seniors who joined today. Thank the executive of ART who has joined, all the esteemed delegates who have joined and given their inputs. And as usual, Chitrakala from Shield Pharma has helped us to conduct the program. Special thanks to Sharda ma'am. We'll come to Delhi and meet you once in person. Like to do that. Thank you so much. Thank you, ma'am.
Thank you, madam.
Thank
Thank you.
Thank you. Thank you. Thank you.
Thank you, madam.
Thank you. Lovely. Very crisp.